Good evening, Somers, and welcome to the Somers Town Board work session of Thursday, April 2nd. If you would please join me in Pledge of Allegiance. I pledge allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
with liberty and justice for all.
Thank you. Okay, there's been a lot of discussion over the past, well, since August, about the formation of our Somers Sewer District number 2. Early on, before the world changed, we had put on our agenda for April 2nd to hold public hearings on the formation of the district. These are the same public hearings we had in August and a few over the fall. Obviously, because the world has changed, because we're distancing ourselves, we postponed, the term is adjourned, these public hearings to a later date. And we're doing that because certainly we recognize we want to once again capture all the comments, get the input from these lake communities that are involved in the sewer district. So what I'm would like to do is we're going to put up a graphic of the financial piece. This was the piece that was we worked on over the winter. We presented this at one of our prior board meetings, and we'll put up that graphic as we go through the mechanics of opening the public hearing and then immediately adjourning it to a future date. So Roland, any direction or comment on that?
Well, you should open the public hearing, and that's when Steve should make his presentation, and then make it clear to the public that comments and questions will be received at a later date and then adjourn.
Okay, so why don't we do that? I'll make a motion to open the public hearing for the establishment of the Somers Sewer District number 2.
Can I make a comment, Rick?
No,
Can I make a comment?
I'm opening the public hearing.
Okay.
Second,
Second.
all in favor?
Aye.
So moved.
I need to do publishing posting.
Publishing and posting, Patty.
That was published in the Somers Record on March 19th and posted on the town clerk's bulletin board.
Thank you. And Bill, you had a comment?
Yes, I just think procedurally, we're doing exactly what should be done, and we appreciate following the process. I think it should be somehow emphasized, though, that we are not adjourning and dismissing, we are adjourning and postponing, because a lot of comments have come back and said, well, you're just, you're dismissing us, you're adjourning us, what have you. Just procedurally, I think we need to be a little more emphatic about the fact that we are just postponing the additional comments from the public.
That's what adjourning is. Adjourning.
I know that, and you know that, but John Q. Public doesn't.
Right.
No decisions are being made tonight. That's all.
Right.
Nobody's
It's
saying
going to be
anything
open to be determined time frame. We don't even know when yet, based on what's
Understood.
happened.
Understood.
Exactly.
Right.
I mean, look, this is the new normal. If in fact we have to run public hearings virtually like this, then the fact of the matter is we're going to have to accommodate public comment,
We'll have
and
to
we will
figure
do
out
so.
But given the timeline, if it, let's say we get past April 30th and we're back together, does that just, then we'll be able to hold public hearings in a normal fashion, right?
I think by that time, if we cannot meet face to face, we will have the capability of entertaining public at a public hearing. Public can comment tonight. There's numbers they can call in. This is streaming on YouTube, which takes input. We have a phone number that's been posted. And Patty, you can give that out after we close the hearing. But these are ways that people can participate in the public hearing.
Can maybe,
So with that said, I'm going to make a motion to adjourn the
No,
Somer Sewer District number 2.
no,
Oh, no.
Rick,
I think Roland said we got to hear,
the presentation that Steve is prepared to make should be part of the public hearing.
Okay. And okay, so Steve, why don't you put up your graphic and you can walk us through it. Thank you.
Sure. I just want to confirm that everyone can see that, and then I believe you should be able to.
I can.
awesome.
Good. So as part of the public hearing that is going to be continuing after this, sorry, I wanted to just summarize the overall aspects of the project for those that may have these basic questions. And as you said, Supervisor, obviously there'll be an opportunity for the public to provide comment during a public hearing at a later date when it's resumed. But as a broad summary on the project, the proposed district is 989 parcels in total. There are 103 parcels in phase 1 of the construction. That phase 1 construction is estimated to cost $10 million, and no borrowing is proposed to occur for that phase 1 construction. The map plan and report limits the total project borrowing for the full build out to $16.2 million. What that means on a parcel phase, and only at that time during the period when phase 1 is the only portion of the homes connected, those homes in phase 1 would pay a flat fee of $591 per year. That includes basically the county buy-in, the county O&M, and local O&M. O&M is operation and maintenance. It's the cost to run the sewer district and operate the sewers. When the project is completed at full build out of 989 parcels, and there's been a project borrowing of $16.2 million, all parcels, including those that were initially connected in phase 1, would pay a flat fee of $1,187 per year. The changes that occurred in this map plan and report from the prior proposal are that the county has agreed that they are going to consider waiving the buy-in and operation and maintenance costs for those homes where there is not construction of a sewer going to their home yet until that time. And by doing that, that allows those homes that are outside of phase 1 not to pay anything until that construction proceeds. The other major change was the shift from an ad valorem or property value based assessment of costs, both for phase 1 and for
Wendy, check channel 20, see what it looks like. Okay.
I was curious about that too.
Both phase 1 and all parcels would be on a flat fee basis. So every parcel, no matter the size or value, would pay the same amount, and that is a change based on public comment from the prior version of this project. So that's the broad summary. We are prepared to present much more information and much more context on this during a future public hearing. But for now, since it's being adjourned, I just wanted to provide some very basic information. And I think a lot of the comments are around costs, and so I just wanted to quickly present that again.
Right. I thank you, Steve, for that presentation.
I just want to ask one question. Steve, on your little PowerPoint there, has phase 1 construction, then total project borrowing capped at 16.2. No one should misconstrue that the phase 1 cost will will be 16.2 million borrowing. That is the total cost of the whole project, but not for phase one. Phase one is 10 million with no borrowing. Am I correct in that?
You're correct, Councilman. Phase one is being constructed only with the settlement funds from New York City DEP with no additional borrowing, and that's why it's limited to 103 parcels.
Got it.
And so as phase 2 and 3 come to fruition, which we really have no plans at this point, the cost per parcel would go from 591 to 1187, primarily because of the financing, right?
That's correct. It is the financing that gets added in that is the difference between the round numbers of $600 and $1,200 per year. Yes.
And what are the rates on that financing, or is that unknown?
We've based it
Yeah, no.
on rates as of a couple of months ago, and those have certainly decreased since that time.
Could you give us an idea of how this timeline would look like?
Sure. So for where we stand right now is we are in public hearing to inform the town board as to whether they would like to move forward with this project. The way it has been proposed to move forward is by virtue of a referendum. So if the town board agrees to move forward, then this would move forward with a referendum for those parcels that are proposed to be in the district to vote on this. That if it is approved, would then go to the County Board of Legislators with a petition to expand the Peekskill Sewer District. Ultimately, the wastewater from Shenorock and Lincolndale would be sent to the Peekskill wastewater treatment plant, and thereby the county needs to enable that to occur through expanding their Peekskill Sewer District. If they vote to do so, then the project would move forward through design, bidding, and then construction for phase one. At an appropriate time, it could be concurrent with that, or it could be at a later date. Design would proceed for the remainder of the construction in one or more phases, depending on the availability of outside funds. Those might be funds from the DEP, those might be funds from the state. There's certainly in the news currently discussion of infrastructure stimulus funds. So that is another potential source of outside
Right.
funding.
Steve, I want to thank you for the presentation.
Thank you.
We did tell and had that told the public, we were going to open this meeting and adjourn it. I wanted to get this initial slide up here just to refresh everyone's memory what the costs associated with establishing and running this district would be. But even our town board questions, let's hold until we have a formal public hearing. So Steve, thanks for the presentation.
Thank you.
And
Supervisor.
obviously we'll keep you in the loop when we get back to a full-blown public hearing on this.
Sounds good. I'm going to take the slide down.
Okay, thank you.
Thank you.
Okay, so we received several text messages from people asking why we are even having that much discussion.
All right, Roland, I'll let you handle that.
Well, you wanted to get that presentation into the record, and now it would be proper to adjourn the public hearing, as you said you would, until a future date not yet determined.
And that's what I'm about to do. Patty, was there any other questions we need to answer before we close the public hearing? I saw there was one about, does this public hearing count? If you are opening public hearings tonight, does it count as a public hearing? Well, yes, it's a public hearing. We're opening it, had a brief presentation, and we're now closing it.
No, you're adjourning it.
Adjourning
You're
it.
adjourning it.
Let's adjourn it and move on.
Wow, you guys are all over me.
If
Yes,
there are,
adjourning.
we made it clear that we were going to open it and adjourn it. If we start taking this question and not that question, we're not doing what we said. So if there's questions concerning this public hearing, we should just move on. And, you know, we said what we did is we had to have the public hearing. We posted it, we published it. By law, you have to have it on here. We're doing what we think is best, which is we're not going to make any actions. We're not going to do anything until the public can have their input, and we're going to move on. So I would agree, and I would make a motion that we adjourn the public hearing until a future date.
Do we have a second?
Second.
All in favor?
Aye.
Patty, you had a question?
So
I do.
moved.
I do. Just one last question that came through is how many more public hearings will you have?
I mean, we can have as many.
I
as
would say a
possible.
minimum, so here's where we are with the sewer district. We cancel the public forum. So we will be having a public forum. We will have at least 2 other public hearings. To answer that question. Okay, moving on the agenda to public comments. I'll make a motion to open public comment.
Second.
Second.
All in favor?
Aye.
So moved. So the public can participate in public comment via those vehicles I mentioned earlier, by phoning in, by texting in. And Patty, I'll call upon you. Any other questions, public comment?
Well, the phone number is 804-6613. I would suggest not leaving a message and to call back if we're on the other line. We did receive a couple of emails here. I didn't know if you wanted to address the emails, town meeting. There's a couple of,
There's a few regarding the sewer district. Again, one that we just answered regarding how many more public hearings can we have. There's a statement that, I'll read the statement. This is from, I assume if it's on here, they don't mind if their names are read. This is from Linda Luciano regarding the sewer district. We were not given a chance to ask questions at your meeting on 3/5 after the engineers got up and told us of the changes, and we haven't been able to since. So that's a statement. How many more public hearings do you plan? We just answered that. And then there's a question of why aren't you using a video conferencing service so people can attend your meeting virtually and ask questions? I mean, I would say this is all new to us. If we, as the supervisor said, if we continue in this state that we have right now, we will figure out a way that we can bring a bunch of people on. But this is all new to everybody on this call right now. And I don't think 3 weeks ago, nobody would ever thought we would have to do this.
okay,
So,
I got our first phone call.
who's the big winner?
Go ahead, let's make sure they can hear you.
So I'm watching it now. They can hear me now?
Yes.
They can hear you.
Okay. Hi, this is Lisa Healy from 7 Magnolia Drive in Lake Lincolndale. I had there was going to be no discussion, no presentation regarding the sewer district. I sign on to the YouTube and there are slides up talking about costs. So now I feel like I've been lied to. And this is extremely upsetting to me. The attorney who spoke about why we were doing this gave a non-answer again, which he usually does at every meeting. How many public hearings are required for the sewer district? And once you have one public hearing, does that trigger a clock to tick?
No.
who answered that? Because I'm having trouble knowing who answered.
That was the town attorney.
That was the town, right? There's no time frame connected with public hearings when they have to be held.
And Roland, we could have multiple. We don't have to limit it to two, do we?
There's no limit.
There's no limit.
Right. It's up to us when we feel we've gotten enough information, when we've heard from the public, when we would close a public hearing. It could be one, it could be two, it could be 10.
Okay, thank you. Thank you for your call.
Right, one more thing, a recommendation. The Board of Education this week had a meeting and allowed parents to call in and ask questions. They did it in this session to ensure that there was transparency for the meeting, especially since we're in this whole new world of distance learning. This is not effective at all. As I can see on the YouTube, everyone's speaking. I have you on mute so that I can get my message across. There's a delay. This is not effective. And if you want to be a board that is trying to be transparent, you should then utilize technology that will allow that to happen.
Okay, well, we're working.
Right.
All right, we're working on getting this better, as we stated up front. So I'd like to move on. We do have the county executive in the queue. So I would like to close public hearing, close public comment at this point, and allow the county executive to come on and give us his presentation.
Hold on one second. Patty, do you have any more calls or no?
I didn't get anything else, no.
Okay, all right.
Okay.
Okay, I'll make a motion to close public comment.
Second.
All in favor?
Aye.
Aye.
So moved. So George, if you're in the queue, you're on.
Thanks, Rick. Mr. Supervisor, I appreciate it. Members of the council, happy that you could spare a few minutes. I'm joined on the phone by Ellen Hendricks, who's our Assistant Director of Intergovernmental Relations. Just want to give you a quick update as best as we can about where we are in the county on this COVID-19 outbreak. And then if there's time, I'll take any questions that you'd like, and then I'll let you get back to your agenda. We're obviously all on a road without a roadmap, and we're dealing every day with numbers that are getting more serious. And none of us know exactly how the story turns out. What we heard today from the governor is that on a statewide basis, there are 92,000 cases of COVID in the state. That's a huge number. And in Westchester County, 11,560 people have tested positive for COVID as of the state figures today. The hospitalization figures in Westchester County, if you view the 11,567 as our baseline, we have 344 people hospitalized, and that's about 3% hospitalization rate, and we've lost 67 people. Now that's under 0.5%, but we're starting to see things quicken in pace. Just today, we lost Glenn Bolito, who was an Eastchester Town Councilman. We lost the mother of Judge Helen Blackwood. So we're starting to see people we know, friends and faces that are important to us. We've had trouble with numbers reporting. I've tried to be diligent with the supervisor most every day, sending him numbers that we had available that corresponded with the shared file that he and your police department, fire and EMS have access to. But the problem is we are getting almost 2/3 of the cases unknown information from the labs and the research. They're not required to get full addresses. And so even though we have a number for SOMers from 2 days ago of 39 cases, that may have jumped up a little bit. That's probably only a fraction of the cases in the town because of this unknown element. It makes it very difficult, for folks to know in the communities, and we want to be transparent about these things and provide
George,
information. So
yeah, George, I'll just interrupt for a second and just let you know that today's number for SOMers is up from 40 to 44. So that's what
Okay,
is in the sheriff's
10%
office.
increase.
Yeah, that
Okay.
increase.
And that is part of the frustration, because even with the number at 44, with so many unknown, 2/3 of all the cases, these 11,000 cases, we go into a database that the state provides. But it does let you know, if you look back a week ago or 2 weeks ago, the explosion in cases has been dramatic. It's 4 weeks ago since Westchester had their first case, and now we have 11,000 cases. We are trying to work, you've seen the governor do this stuff on television. We're trying to deal within the context of Westchester with how many hospital beds do we have at the ready. Right now, all the hospitals in Westchester comprise about 3,000 beds, a little over 3,000 beds. Their governor's asked the hospitals to add 50% more of that number, 1,500. I don't know if the hospitals can physically do that. I assume they'll certainly be able to do some additional rooms. How much more, I can't tell. We've turned over the county center to the State Department of Health, and they have indicated they'll probably be able to fit 110 beds in the Westchester County Center. That's a pretty big space. And so for 110 additional beds, it's certainly helpful. We just don't know how many we're going to need at the peak of contagion. It's been said as a percentage that 80% of the people that test positive will walk away from this. 20% of the people will be taken ill and require hospitalization, and then some percentage of that 20% we will lose. And it was more in Italy and less in South Korea, and there are a lot of factors that go into that. But these are serious numbers, and when we know that these are people we know in general terms in the county, to lose even one of them is a tragedy, much less to lose 67. And unfortunately, people who are vulnerable of a certain age, people who have pre-existing conditions, COPD, asthma, they're subject, very vulnerable to this. If you have cancer treatment, if you have AIDS, all of that makes this vulnerable. From a county standpoint, the things that we're focused on doing, I mentioned already the county center. A number of weeks ago, we turned Glen Island over to the state as a testing center. That testing center has processed a lot of tests down in New Rochelle. Westchester Medical Center is a testing center in Valhalla. We have offered to the state the FDR Yorktown parking lot for a northern Westchester testing center. The state controls all the testing. We made the argument that there ought to be a center in northern Westchester, for northern Westchester and Putnam. And we thought that location, because it's under the county control, would be an easy choice. They're looking at it. I guess they haven't made a decision yet, but we're prepared to see it at any point in time. And, the testing is really critical. You have to know if you have the disease or not, to know whether you need to isolate so that you're not affecting other people, and then also to give yourself the best possible chance to fight this off based on your physical health and so forth. When we go back to the numbers, basically the amount of infection pretty much follows population numbers. So the 5 highest communities in the county with the most number of cases are the 5 most populous communities: Yonkers, New Rochelle, Mount Vernon, Greenberg, White Plains. And then, at the bottom end are the ones with the smallest population: North Salem, Pound Ridge, Village of Buchanan. So I think what we're seeing is sort of a proportionate spread around the county where nobody is untouched, but the degree of cases, really depends on the population. And we worry about those centers where you have lots of senior citizens. You have Heritage Hills as a very significant portion of your community. Other communities have nursing homes, assisted living facilities. You have a couple here and there. So those are the ones that we're most concerned about. If the contagion gets into those areas, what will happen? Besides the county center in Glen Island, the county county health department nurses are out in the field every day, double shifts to the greater extent, and they're doing testing in conjunction with State Department of Health nurses. So our health department is fully engaged on this all the way. Our emergency operations center down in Hawthorne, John Cullen's department, is tasked with serving as a clearinghouse for ordering, receiving, and redistributing personal protective equipment, PPEs, which is an acronym I knew nothing of a month and a half ago. They're also responsible for hand sanitizer. And my understanding is every town makes a request by email, wceoc@westchestergov.com, for whatever they feel their resources are. Then you distribute them as you see fit. Fire departments, emergency services within town offices. If you have special entities in your town that you're going to provide it for. That's all pretty much up to you. Hopefully, your requests are being responded to. If they're not, then Ellen Hendricks, who's on the line, will have a conversation with Rick or whomever, and we'll try to juice the process along. We have Susan Spear of our team, who's based with the EOC team, and so if we're not getting the stuff back from the state and getting it to you, we'll try to push harder on that score. We know that we're facing a big economic development problem. It's here already. It's affecting our budgets. I've already said that the state budget is in a free fall. Pardon me, the county budget is in a free fall because the sales tax has fallen off the table. With that in mind, though, for average individuals, the people who are hurt, losing their job, people with businesses that they're closed up, they can't make the money they needed. Our economic development team, led by Bridget Gibbons, is trying to serve as a clearinghouse for information, trying to get information shared to the Chamber of Commerce's and other vehicles so we can find out how to help individuals. Frankly, the biggest help that's coming so far is the stimulus bill that was just passed down in Washington. We're not really sure of all the provisions of it. We look to the Congress members and the U.S. senators to help outline it. And we're hoping that we're going to see tangible benefits coming for individuals. The state unemployment insurance system has been jammed up with so many claims, as you can just imagine, with a high percentage of people. All the restaurants are closed. Those are all hourly employees. Hotels are down dramatically in business. The bars are closed. Nail salons, beauty salons, movie theaters, bowling alleys, barbershop. It's an incredible shutdown of the economy, and obviously none of us have ever seen anything like this. But in terms of the economic development efforts, we're going to try to extend information to get out there. And at some point in time, the bailout, if you want to call it that, or the financial assistance, if you want to call it that, it needs to come from the state government. Will have to come down to towns, villages, cities, and county governments as well, because there's no way we can balance our budgets without layoffs and furloughs and all sorts of very draconian things, which won't be possible. I did want to mention that it doesn't really affect you all that much, but the Beeline bus system has moved to reduce schedule service. It's called enhanced Saturday service, which means less than normal weekday service. And if there are people in the community that use the Beeline bus, whatever routes they might take, there's less runs a day. We've cordoned off the buses to protect the drivers and to socially space the riders. Ridership is down dramatically, and we gave up trying to collect ridership fare. It's a free system until we're through this contagion, and we'll see how it turns out on the other side. I don't want to go on and on and on, but I think that's the basics of it. I made a proposal to the Board of Legislators. I know the supervisors made an alternate proposal to deal with county taxes. The Board of Legislators will discuss and act on whatever direction they want to go in. And I know Rick has been actively involved in that dialogue and discussion. He can brief the board what the supervisor's proposal is, and if you'd like my proposal as well. But I'm comfortable with the board making whatever decision they make. My mission here is to try to be helpful as I can, and we're all going through a bad moment, and we're all going through it together, and we're not going to get out of it unless we all do that together. So with that, Rick, I'm happy to take questions as you see fit.
Okay.
Go ahead.
Now, I know that we do have some people on the queue, but I don't know that they have questions for you. I'll just take this opportunity, George, to personally thank you on behalf of the town board and the town of Somers for your leadership during this unprecedented virus outbreak. You've been a very steady hand, and you've done a great job in communicating what has to be said to communities. So thank you for that.
Yeah, George,
Thank you, Rick, and I appreciate your partnership.
This is Tom Garrity. I watch your streaming reports every day while I'm at my desk working, and they're good, they're concise. So we appreciate you getting the information out to us.
Thank you, Tom. I appreciate that as well.
And just a quick question, County Executive Latimer, thanks for the update and thanks for joining us. This is Councilman Faulkner. Just a quick question for you with regard to, and you may not have any additional insights to this, regarding the Small Business Association loans, etc. Is that going to be done at the federal level or the state level? Because we've got a lot of friends and family in town who are looking to participate in this loan just to keep their small businesses afloat, which, as you know, employs half the country.
It's an amazing hit, and I see it in the community I live in, and as I travel around the county, every downtown strip is a ghost town, and it's I don't know how folks survive it. I don't know the answer to your question. What you certainly can do is drop me an email, latimergeorge@gmail.com, and I will pass it on to Bridget Gibbons, and I'll have her give you a call, and then she'll be able to decipher. And probably you want to talk with her because there'll be like a question that follows the question, and then you can have some dialogue with her, and she'll give you the answers as to how this is being structured. I think some of it isn't really defined yet because of what the feds have just done and how they want to channel it through. And one of my concerns is that I want to see them make sure they get the money directly to the businesses and not channel it through the state or even through the county, which makes it more bureaucratic, and come up with whatever the policy is, that'll be straightforward enough that a business can apply and they can provide the information they need to justify, the support that they need, and make it as least bureaucratic as possible.
Perfect.
George, if I can ask you two things. It's Rich Clinchy.
Yeah. Yeah, Rich.
I've enjoyed sitting in on your Monday, Wednesday, Friday conversations, and as Tom and Rick said, they're informative, they're even-tempered, they're honest and upfront. So you're the Anthony Fauci of Westchester. So thank you.
That is a great compliment.
Two questions though. One has come up several times on those conversations, and it has come up today with some neighbors. Can they have a landscaper come in and cut grass? So that's come up several times, especially from your friends in Rye. Do you have anything else you can add to that?
Well, this is an issue that's gone back and forth between two different departments of state government, ESDC, Empire State Development Corporation, and the Agriculture and Markets Department. And they have each at various times over the last few weeks given conflicting advice. My understanding right now, as I sit here, is that landscaping is an essential service if it is basic maintenance, to cut grass, cut back hedges, make sure that vermin or insects don't congregate, and that portion of landscaping is legitimate. What has been under debate is whether the next phase of landscaping that involves what I would call planting of trees, planting of bushes and flowers, things that somebody might describe as ornamental or style-oriented rather than functional landscaping, is what's been in question back and forth. I think I'm going to have to double check to make sure whether that second area is or isn't legal. I've heard both of those two things, Rich. And again, with Ellen on the line, she's going to take a note tomorrow. We'll call the relevant agency. We'll get a clear answer for you and share it back with you. But this has been back and forth. And if you've been on some of these calls, I've given advice based on what I was told, and then somebody else in the state administration had a different advice. And now you got people, particularly local officials, bobbing like corks in the water between two separate points of view. So we'll clarify it and we'll get back to you tomorrow. My understanding, though, is that basic maintenance landscaping is essential, is okay. Ornamental, decorative landscaping is not considered essential.
Yeah, I have a neighbor, that's his business.
Subject
and
to
that's
being
what
corrected.
Yeah, that's what I passed on to my neighbor who is a landscaper. I have another neighbor, though, who yesterday lost his job. And so he started going on the website for unemployment insurance. Crash, burn, can't get in. I've heard that from a second person today, too. Do you have any advice about that or any insight, or is just keep trying?
Well, my understanding when I've spoken to my state official friends is that they're trying to get the system back up. It is there's a brutal amount of demand right now. It's somewhat similar to what we're facing with our 211 hotline, is that we just get overloaded and you try to get on and it's impossible to get on. We have 8, 10 people taking phone calls, but we have when people get on, it's a complicated phone call and you can't get off that fast. It's not like, we'll tell you what time it is, and then you move on to the next call.
Right.
What I would suggest, though, is reach out to Kevin Byrne and Pete Harcum. And now that they're finished with the budget or near finished with the budget, they're probably in a better position to tell you what efforts are going on in Albany to try to straighten out the unemployment mess. But, what I'd heard was they were making strides to add staff and to try to get the hotline to actually function properly. And that, in the words of that soul song, "Hold on, I'm coming," it's going to get better. So I believe that's what we're hearing from Albany at this point.
Thank you.
St. George, Councilman Anthony Sirico. Thanks
Yes,
for
ma'am.
the updates. Well appreciated. You referenced 3,000 beds in the system right now, and I was just curious if you had put any context around, the capacity that we have and how you're feeling about that. And
You put your finger, Anthony, on the most important. You put your finger on the most important question in all of this, which is how many people are going to get sick enough to need those beds. Now, right now, we have 11,500. So you do 20% of that number. That's the number that I've heard as being the number of people that could need. So you do 20% or a fifth of that number, and you get in round numbers 2,000 some odd sick people out of the current amount of people. So you've got 3,000 beds. There's a certain number of women who are there in labor. Somebody's had a heart attack, somebody has had cancer and they're in the hospital. So there's other reasons to be in some of these beds. But at the moment, if it's 20% hospitalization at its peak, and right now it's 3%. So our system today could handle that amount of demand. Now that 11,000, if that quote unquote flattens out, if over the next week that number doesn't grow dramatically, then we've met the peak and we can handle it. But we don't know that we're anywhere near the peak. That 11,005 number could go up to 22,005. And then all of a sudden, instead of needing 2,000 beds, now you need 4,000 beds. And at that point, you're bumping into whatever the maximum is that we can do in Westchester County, given the amount of beds we have now, the 110 we're going to put online. And that's where people are nervous. We all are, thinking that if we don't flatten this curve now, and it doubles from where we are today, we're on the cusp of the tragedy that we saw in Italy. And, and then the other complications are how many beds do we have? That's one issue. How many doctors and nurses do we have available? We've put a call out to get volunteers to add to our regular resources. How many of those doctors and nurses stay healthy? Because they're dealing with infected patients all the time, and many times it's the healthcare workers that get infected. Once they go out of service, we now have less to deal with their group. The PPEs, the gloves, the masks, the gowns, and all that stuff. We're striving to make sure we have enough of that. And then you get to the magic situation, which is beyond any town, any county, and that's ventilators. Because what happens with this disease is, I guess everybody knows by now, it attacks your respiratory system. And there is no antiviral drug. There is no quote unquote cure or treatment. So basically what the ventilator does is it keeps you breathing long enough, if you're healthy enough, if you're hydrated and all the other things they do, keep your fever down, that your natural body physicality fights off the virus and then you survive. Just like the first guy, Lawrence Garbus, who was in the hospital for weeks, but he walked out of there. And he's home and he's recuperating. He's a reasonably healthy guy at 50, although he had a pre-existing condition. So Anthony, that's the number of what holds. You could double the number of cases and have a 20% hospitalization rate, and we could still hold the line in Westchester. Now, there's one more thing to mention. If we have open beds and somebody gets sick in Putnam, we're going to bring them into Westchester. I mean, there's no wall around our county. And if somebody gets sick in Rockland and they don't have a bed and we do, we're going to take them. That's not even in question. So what I worry about as well is that we're doing what we can do in the county. We're trying to hold the line. I think, we could hold the line. And then because other places have an overflow, we may find ourselves to the max. And then when you get the next patient after you've maxed out, and that Westchester patient, then that person needs the bed and we don't have it. So, I'm hopeful that this thing does in fact flatten out where we are. The recent numbers You know, what Rick just said, going from 40 to 44 is a 10% increase in a day. And, you know, 4 doesn't sound like a lot, but if you have 4, then tomorrow 4, then soon it's 5, and you keep going, by a week from today, you have 60 or 65. And Somers and, you know, North Salem and Lewisboro has a relatively small number of cases. Yonkers is pushing 1,000. The other big cities or big communities in the county are all 400 or more each, and they're growing. If they grow 10% a day, that's 40 and 50 cases. So that's, Anthony, there's the problem, and you put your finger on what we're most concerned about.
Well, we're just hoping everybody just complies with the protocols that we're recommending, and you know, distancing and stay safe and the like.
George, just out of curiosity, I know you're saying we'll have, you were talking all about Westchester numbers. You know, we've been hearing that they're starting to move some people out of, you know, the city because they're running out of beds. Have we gotten anybody from there into our hospital?
Well, we have. We have. I don't have a number, you know, because I don't have access. What numbers we have with all of the frustrations we have are Westchester numbers. We don't see what's in the city. Certainly in the southern part of the county, the hospitals we have in the southern part of the county, like Montefiore, for example, is connected in the Bronx with a couple of hospitals there, and then with New Rochelle, Mount Vernon, they have an affiliation in White Plains. So it's certainly true that we have some patients in Mount Vernon and New Rochelle that come out of the Bronx, certainly. I think it's legitimate to be concerned that New York City, because of its size, I mean, it's 8 times our size. And the likelihood is that they're going to have a much higher rate of hospitalization and a higher rate of deaths, and there's going to be a push our way. I am also equally concerned about Rockland and Orange as well. They also have some communities, ethnic communities, for which social distancing has not really been practiced very well. And I worry that that group will potentially get sick at a higher percentage than what we're having. What was just said a second ago, you know, we have to socially distance, we have to stay home as much as we can, and all that stuff. It's strange for all of us to do, but at least we don't, our cultural, you know, circumstances don't get in the way of that, or our living arrangements don't get in the way. You go through your community and you have very little of what anybody would call multifamily, you know, complexes. But in the city, people are packed on top of each other, you know, apartment building after apartment building of 150, 200 people, and contagion can spread disproportionately faster there, and then also in some of those other communities. So there's legitimate concern that in Westchester, with a narrow scope, we may hit the mark. We may flatten out in time and have enough Westchester beds, but you know, we may find ourselves in the middle of a sea of people that need healthcare beyond that. All of this stuff is being coordinated through the State Department of Health under the direction of the governor. So we in county government, just like you in town government, we really don't control any of it. You know, we're limited to the things we do, the Beeline buses, our park system, you know, what assets we've turned over to the state. But it's really the state DOH that's going to manage this patient inventory, and you know how hard we work at making sure we don't have too many patients sick at the same time.
Thanks, George.
Thank you.
Thank you all very much. I know you have other work to do tonight, Rick. I appreciate it, and we'll talk to you tomorrow on the.
Okay, George, just hang on one. Patty,
Yeah.
Was there a question for the?
No, but I received a phone call as you were closing public comment that I have on hold.
Yeah, I think we.
Okay, so we'll get to that when we say goodnight to George. All right, George, once again, thanks again. I don't know how you do it. I know you've been on the majority of town board meetings in our new world. So keep up your stamina.
Well, thanks a lot, guys. I appreciate it very much. And you all be safe and healthy, and hopefully I'll see you sometime. Come back up at some other time, see you in person, and we'll go out and get a beer.
There you go.
Thank you.
Thank you.
George.
Bye-bye.
All right. Have a good night, all.
Okay, so that was our county executive. I know we kind of raced through public comment. Let's go back. We'll reopen public comment. Motion,
Second.
Second.
all in favor?
Aye.
Aye.
So moved. Patty, who's on call?
One email real quick that we got that we didn't handle. Again, this is a comment, so we're just going to read it. We don't need to answer. It is from,
Right, Tom?
Yeah.
I think we have a phone call that's on hold.
all right, go ahead.
Let's do the phone call.
Okay, here you go.
Hi, Linda Luciano,
Oh,
at Corporate Drive. Thank you for reopening public comment because people were calling in after the last caller, but we kind of just got cut off. So I appreciate it. I know that people have texted in questions for your meeting tonight, and I'm just wondering, are you going to be answering any of those questions during public comment?
Linda,
No,
we're going to be reading them. I have some to read right now. I saw one from, I guess, your friend Ada, that I will read that. And we'll see if we have some others.
Okay, so I'll just say what I have to say. Obviously, the last thing that we want to be talking about during this global pandemic is sewer systems. Back on March 5th, when you guys, engineers, come to revise it and speak at the meeting, you didn't let the public ask questions after the engineer spoke. So I just wanted to bring up a couple of points about this revised report that still does have flaws in it. It's going to take a long time for people to recover financially after this crisis. And I don't know what the state or county is going to have in money to give us for sewers. But residents need to understand that the town is not publishing true costs in this revised max plan and report still. If you look at the cost tables on pages 4-4, 4-5 in this report, they're basing it for 7-Eleven flat fee finance on getting the $46 million in grant money. But obviously, if we don't get this grant money, people need to know the true numbers, which is an actual flat fee finance cost of $22.92. That's $2,292, which brings the overall cost per parcel to $2,767 at a full build out. It will not be that $1,187 that's in the report. They're publishing the best case scenario. You should hear and let the people know the true numbers so residents know the worst case scenario. If you look on the page 4-2 in this report, it shows what the residents are responsible for. It's a key thing people want to know, which I'm glad that they fixed that section because in the previous report, there were only 3 bullets, and now there are 8, which shows people that they were not telling everybody their true costs and what they're responsible for. So if anybody wants to see the breakdown of what I'm speaking about, they can obviously open up that map plan report, or they can go to somersewers.com, and there's a table that lays all that out for them. But I just wanted to comment on this tonight. Thank you.
all right, thank you for your comment. Tom, you have some emails?
Yeah, I have one. Again, I'll just read them. This one is, I think Linda, I have a couple from Linda, but I think she covered what she wanted to in her statement right there. We have one from Ada Monetti, 1 Lakeside Lane, and it says, why aren't you looking into putting storm drains within the whole town? Muscoot Reservoir is much bigger than the Amawalk Reservoir, and salt is going into both of them, which is contaminating our water much more than septics. And then the second part of it was, how are you accommodating your elderly population during this current coronavirus lockdown? Because they can't leave their homes and they don't have computers. Many of us are not computer savvy.
Okay, let me just answer that. I have to say that our senior community obviously are the ones that are at highest risk, and our senior nutrition program under the direction of Barbara Taberer has been doing a remarkable job answering calls and request for service. We have a routine Meals on Wheels program that was up and very successful. We've added to that substantially when we closed the nutrition center at the Van Tassel House. Those people then went on to Meals on Wheels. And every day there are hundreds and hundreds of meals being delivered to our seniors. And we will continue to do that. If there are seniors out there in jeopardy or need help with shopping, you can call my office, you can call the senior nutrition office, and we will get you assistance. The Somers Lions Club have started to help out with delivering meals. St. Luke's Food Pantry has a drive-through pickup. I also want to publicly thank the North Salem Ambulance Corps. Last week, they donated 100 bags of groceries to the St. Luke's Food Pantry. And, you know, we're all in this together, and we're really looking out to take care of our seniors, especially. Next. Is that it?
From what I could tell, I think that was it. There were a couple from Linda, like I said, but I think we answered most of them. You know, it was about adjournment versus this. You know, some people were, I think what, just to sum it is that next time if we do have a public hearing, maybe we need to talk to the school and see what they use just so we could have more people involved on it. But Patty, do you see any more that I'm missing?
Is Steve on the line? Maybe he wants to address some of the numbers that she put out there.
Sorry.
No, I don't think we want to do that.
No, we're not going to get it all back and forth when we aren't right in front of the people. We're going to have plenty of time to discuss
There'll be plenty of time when we have our
Okay, that's fair.
official public hearings on that.
I don't think I have anything else. I was muted when I answered your question.
Thanks, Patty. I think we're good to move on
Okay.
to the agenda.
So seeing none and hearing none, more for public comment, I'll make a motion to adjourn. To close public hearing. Public
Second.
comment?
That's it.
Public comment.
Comment.
Public comment.
Public
Yeah.
comment.
It's been a long 3 weeks, gentlemen. So moved. All right, our next agenda item is the addition of Article 24 to Somer Town Code, establishing regulations pertaining to retail sale of marijuana in the town. So, just as a refresher, probably 6 months ago, Roland had drafted some legislation that we put on hold pending what the state was going to do regarding legalization of recreational marijuana. And it did not come to fruition, but before the world changed, the indication was it was moving in that direction. So with that, acting on that trend, we decided, why don't we get our legislation in place? And to do that, the first couple of things we have to do. So I'm making a motion to declare ourselves the lead agency with the regulation pertaining to retail sale of marijuana in Somers.
Second.
All in favor?
Aye.
Aye.
So moved. And then the next item would be to set a public hearing on the legislation for May 14th, 2020. Do we need to move that, Patty, or we could just establish that? Or Roland, I'll ask you.
Hold on, I'm sorry. I would just put it on
Yeah.
next week's agenda to schedule a public hearing.
Okay, put that on the consensus agenda. Thank you. And then also on the consensus agenda, we'll put in to refer the draft legislation to the Somers Planning Board and Westchester County Planning Board for their review and comment.
Now, this is presuming, Roland, that the town has an option, which we'd spoken about earlier, on the logic that if individual cities could withdraw, why not a town? Although, isn't it more likely now that it'll be county by county, if indeed that's even allowed in the state law?
The,
I mean, I'm for
the
whatever this is.
original, the original legislation that we drafted had called for the prohibition of the retail sale of marijuana in Somers.
Right,
The latest draft of the state legalization law provided specifically that towns and villages would not have the ability to do that. Only cities of a certain size and counties would have the right to opt out. But no
Right.
longer were we in that nebulous land of thinking maybe towns could also jump on board.
right,
Now specifically, that option has been taken away. So the legislation you have before you now is something that Surratt drafted, which goes along the lines, I think, of the e-cigarettes, of where you will allow it and where you will not allow it. But it is not a prohibition.
okay,
Right, so yeah, it has more to do then with our zone, will be prohibiting retail sale of recreational marijuana in certain zones, correct?
Correct.
Okay,
And away from schools and churches and so on.
mm-hmm. Okay. Our next item is number 2, the, which is amendment of Article 3A. I have Cobbling Rock down there, which is just kind of a, to bring the issue to the focus. Cobbling Rock is the most recent conservation easement that the planning board is currently looking at. But this does not have to do necessarily with Cobbling Rock, it has to do with all types of conservation easements. And really what we're looking to do is amend Article 3A of the conservation zoning of Chapter 170, zoning of the code of the town of Somers. So once again, this would be an amendment to our zoning, which would entail, once again, a public hearing. So I'm going to make a motion to declare ourselves lead agency.
Second.
All in favor?
aye,
Aye.
So moved. And then we'll put this on the public hearing on our May 14th agenda. We'll move it to consensus for next week. For May 14th. And hopefully by then we'll have a more sophisticated way for the public to participate. And 3, refer the draft legislation to the Somers Planning Board and Westchester County Planning Board. We'll move that over to the consensus agenda as well. Okay, number 3, under Town Board, is to authorize the supervisor to execute the proposal from Sterling Appraisals, Inc. for preparing a restrictive preliminary appraisal for the assessment purposes of 1 P Way LLC, formerly Pepsi Building Headquarters, Town of Somers, New York, in the amount of $8,750 to be paid for from the applicant consultation reimbursement escrow account.
Oh, no. Rick, this is not to be, the one for the IBM parcel was able to be paid from the owner consulting reimbursement account,
But not this one?
1 P Way is litigation. The town
Okay.
has to pay that itself.
Okay, thanks for that correction. So we will have the minutes reflect that will not be reimbursed from the escrow account. Thanks for pointing that out.
Yep.
Per referral from Roland Baroni, Town Attorney. Additional fees are documented in the proposal. So we'll move this. Does this need to be moved right away, Roland? Is this timely?
No, it can wait until next week.
Okay, so we'll put this on the consensus agenda as well. And then finally, under town board is request permission to purchase one new 10-passenger, one wheelchair van from New York State OGS Group, 40523, award number 23170, contract number PC 69003 SB at the cost of, in other words, we're purchasing a van for $63,628 for email dated March 9th from Barbara Tabor, Nutrition Program Director. And we'll move that over to the consensus agenda as well. As I mentioned earlier, our senior programs are growing. Although we've canceled all trips and things like that, we do expect to get back to normal, hopefully sooner than later. And this van will certainly come into play at that point. Okay. So you can go on our website for current vacancies on our boards, terms expiring. Also under personnel, authorize the hiring of Mr. Donald Spinelli as a part-time available chauffeur for the Somers Adult Transportation Department at an hourly rate of $15 per memo dated March 26th from Barbara Tabor Nutrition Program. That gentleman will be delivering meals. Authorize the reappointment of Don Penzine to the Somers Parks and Recreation to a 3-year term ending March 9th. Authorize the reappointment of Michelle Sands to the Somers Park and Rec Board to a 3-year term ending March 9th, 2023. And authorize the reappointment of Stephen Grug to the Somers, excuse me? Krug, excuse me, to the Somers Park and Recreation Board to a term ending March 9th, 2023. So number 3 through 6, we will move to the consensus agenda.
Yep.
Okay. So I do have a few announcements.
Give him to Patty.
Okay. Just find them here.
You would have had to send them beforehand and I would have been prepared.
If I had thought ahead, I would have done that. Okay, so in the midst of all this chaos and the coronavirus, the census must go on. So be aware that the objective is to count everyone. So if you receive a code in the mail, you can complete the census online, and that's recommended. Get online. I did it the other day. If you have a post office box, you do not have a post box in front of your house, you're going to get a knock on your door unless you go on to the website and fill out the census data. You do not need a code if you do it online and you don't have a code numbers sent to you.
I did it today, Rick, and it was 10 minutes at most. It was really well done, really easy. It's a piece of cake if you haven't done it yet.
Right, and it's just, look, let's face it, we're going to be hurting, everyone's going to be hurting financially. And by counting everyone, I mean everyone in our municipality, puts us in a better financial position for grants and reimbursements and what have you. So I encourage everyone to get out there and register for the census. And certainly you can go online to http://my2020censusus.gov and get on there and respond to the census. This next announcement is going to be received very sadly by a lot of people that like to shred things, like most of us. We're canceling the May 1st
Shredder.
shredder down at Reese Park. I can attest personally that although it starts at 10 o'clock, people start lining up earlier, and it's a constant flow until it slows down. So just hang on to your private papers, and we will get that hopefully back sometime over the summer. I've got a lot of comments from people that say that they don't know what's going on in town. The town board is not reacting to this. That could be so far from the truth. Every day, myself, Deputy Supervisor Garrity, and other town board members are working tirelessly to make this town run efficiently. We're an essential business. We have not stopped working. Our town buildings are closed to the public for obvious reasons. We currently are in a state of emergency. Town of Somers is under a state of emergency, Westchester County, and New York State. And what does that mean? That means for you to stay indoors. You should be sheltering in place. There's a list of essential businesses on our website. I would encourage, and I do tell people that say, well, you're not informing us. Well, other than putting, individual mail in your boxes, we do have a code red system. Sign up for it. It's right on our webpage. That code red, we do routine messages on there. On our website, every day or every other day, we update it with current information from CDC, New York State, and Westchester County. Also on there are videos that myself, Deputy Supervisor, and the Chief of Police do to inform you of current events and things we want you to know about. So,
And they are on Facebook.
And on Facebook, yes, on our Facebook pages. So I just want to reiterate, anyone that is needing any assistance should contact the townhouse at 277-3637. You can contact our nutrition program. You can call the police if necessary. Our police and fire department are working overtime to meet all the needs in town. And I just really want to say a number of things. It's a social responsibility that everybody has to take on themselves. Adults need to counsel their children the importance of social distancing. If they don't get it now, they may not have a chance to get it in the future. I was on a call with Northern Westchester Hospital, and you heard about 344 hospitalizations. So we were always under the impression that younger people are not affected by this. Well, there are people in their late 30s and 40s in hospital beds in Westchester County. Now, these could have been young parents whose kids came home after playing basketball with other kids and infected their parents. This is no way we want our society to get diminished. So when I tell you stay home, shelter in place, we mean it. The town police are now authorized to break up any groups that they see, and they're authorized to issue tickets. So you will be fined for congregating and not staying 6 feet apart from each other. On a more positive note, I want to say, those of you who have been out, let's say, look, you have to go to the grocery store. The roads are empty. People are heeding this warning. We are a very tight community here where we're in it together. And we really are so much strong. And you're making me very proud that we are so compliant. So let's keep up the good work. And our next scheduled meeting will
Hey,
be
Rick,
next
Rick,
Thursday. Yeah, I'm
hold
not
on.
closing. I'm just giving the
Oh,
next
okay.
date. Will be April 16th at 7 p.m. And at that point, hopefully we'll have a little better way of having the public participate in our meetings. Yeah.
Rick, I want to sort of reiterate what you say, because, you know, at the beginning of last week, you and I were working hand in hand at the townhouse. And, you know, we do hear some people saying that they're not getting information, and you're 100% right. There's only so many ways we can do it. We started doing the videos. You know, we even set up a YouTube channel. But unfortunately, now that we're doing it so far apart, the files are so large that they tend not to be able to go through the email system. So I haven't been able to add to that recently. But I know you, along with the town and part of the town, you've been looking out for the Paramount, where we've been able to help them get some of their PPE equipment. And obviously we've been, you know, our highway department is still out there on the roads. Our police department's still out there on the roads. You know, we're trying to make sure they're safe with hand sanitizer and masks and things of that nature. So I know, you know, it's a tough job because, like you said, unless you knock on somebody's door and say, here's what I'm doing, they may not get the information. But we're using the channels that we have available to us, Code Red and the others, to try and get out as much as we can. Again, on another more positive note, I will say what I've said in a couple of the videos. While the active parks are closed, you know, we still have plenty of passive parks open. We still have Kegel, Engelfly. I've been to over to Lasden. I just walked on the bike path today. Everybody keeps the social distance, but you know, it looks like we're gonna, maybe not tomorrow, but we're gonna have some beautiful weather. You know, when you're cooped up in the house all day, you need to get out and get some fresh air. So FDR was great also. I was over there a couple of times. So, you know, when you need a little bit of sanity and you need to just get out, those parks are still open.
Yeah, well said. It's I did a drive-through visitation with my grandchildren today. Pulled in the driveway and stuck my head out of the sunroof and watched them run around. So there's a way to social distance and keep in touch with your family. Wait, Tony, just one more thing.
Sure.
I have gotten some requests from people saying, can you give us hand sanitizer and masks? The supplies that we do get from the National Guard are really for our first responders, for our nursing homes, for our group homes. When and if we ever get to the point where we can distribute it to the public, we'll let you know. But at this point in time, it's to protect employees and healthcare givers. So please understand that. Tony?
Yeah, I want to give a couple of shout outs. I mean, you mentioned St. Luke's. You know, they
Wait,
changed.
one more. One
Go
more
ahead.
shout out. I saw a couple of pictures of some very dedicated people making masks. And I want to thank the Sirico family for their production of masks and the distribution. You didn't hang on to them. You got them over to the senior nutrition program. So much appreciated and thank you.
Yeah, I want to thank, that was Elizabeth, Jacqueline, and Carol. Here it is.
Awesome.
We made they made 70 of these. My daughter's fiance, he's a police officer, so we gave 50 to that precinct, and we've distributed 20 around the town, and we'll make some more as well. But this is what you're doing. I mean, you're getting reacquainted with your family. It's actually fun. The other shout out is
How do they feel about that, though?
you know, okay, you know, the market closes at 4 o'clock.
Pluses and minuses,
For a
Richie.
3-mile walk, you know, around the neighborhood. And we passed by Tom's house and
Yeah.
you can see all that. Just a shout out also to St. Luke's. So they're doing an awesome job. They've expanded that program food program to go beyond just the people that they were serving. I think if anybody's in need, if they call, they'll provide food there to them. I know Lynn Crispinelli and Teresa Rita have done an awesome job. They've been using these masks, and they've been packing foods and batching them into packages for people to come by, drive-bys, and they will hand it to them in the cars. So, that's just tremendous. And as you said, Barbara Tabor, she's doing about 600 meals right now, and it's just amazing. It's just amazing. So,
Yeah,
thanks
this is
for
a
the,
wonderful town, it really is.
I wanted to ask just two things if I can. What we get from the county, that goes to the, like you said, some of the emergency people, people who work for the town and the townhouse, highway, seniors. Do we give them anything that will protect them, whether it be masks? We have a lot of hand sanitizer, I'm told, at least.
Yeah,
Do they get stuff that will help them? Just,
yeah, Tom,
they're
you're
there every day. I
right,
mean, they're
too,
sort of on the front line.
Yeah, Rich, my my kids and I and my wife bottled probably about, I don't know, 700 bottles, somewhere around there. We've dropped them off at the highway department. We've dropped them off with the police department. We've dropped them off with the nutrition department and even the parks department. So yeah, we're making, and I check in with them regularly to make sure that they have an adequate supply. And I think Rick just got, that's the hand sanitizer. Rick just got some masks, and I know he covered Paramount, and then we gave some to the different departments as well, just to be safe.
So our town departments do get stuff to protect
yeah.
them.
Most definitely.
Yeah, I mean, because they got to report too to work.
Oh yeah, no, we're trying
Well,
to keep it safe as possible.
right. And even the fact that, we don't allow the public anymore into our buildings. Over this past weekend, we disinfected the townhouse, the police station, the annex, and Van Tassel House with a disinfectant fogger. And I think earlier in the week, the library and Parks and Rec were done as well. So we are looking out for our own because, once again, we're essential and people are in those buildings working.
How often do that fogger, I know that I think there's reimbursement from FEMA on that. How often do they recommend we fog? Because I think they reimburse like 75% of the cost. Is that something that's ongoing once a month? Or
Yeah, well,
how do we do that?
Right. Maybe we'll do it on a monthly basis. We did have someone who has a cleaning company volunteer. That was after we hired our cleaning staff to do it. But moving forward, maybe we'll take that gentleman up on his offer. But yeah, I would think maybe probably monthly. I'm open to recommendations.
Yeah, I have no idea. Right.
Yeah.
I don't know if we want to look at maybe some of the ones that are used more regularly.
Right, the police station
Yeah, the
certainly.
police are in and out, the highway department's in, well, although I don't know if we did the highway department, but
Yeah, and Van Tassel House, yeah.
Highway was done. Yeah.
those types of places we might want to do a little frequently, because the other places, there's only so many people going into one location.
Right.
Tom, one other thing, just thinking, there's already $2.2 trillion that's been allocated by Congress, going to be dispersed to businesses, et cetera. At some point, they're going to need to allocate more money, much like the stimulus program back in 2009, when you and I were first on the town board. And if you remember, at that time, the thing that they were being asked for was shovel-ready projects. So at the time, we were looking for things. Did we have anything shovel-ready? We didn't really have too much. But it's something I think we should keep in mind, is that if we have projects and they get to that point where they're looking for that shovel-ready, because you want to put people to work, at some point, you're going to put people back to work. And government stimulus is one of the ways that we're going to do it. I would think it's just something in the back of our minds we keep in mind, that projects that require American workers right here, going back to work, doing stuff that's necessary in the public domain, that would be a good thing. I would think we would keep in the back of our minds while this emergency goes on.
Yep, that's a good point.
That's a good point. Good point. Okay, any other comments, concerns?
Just a comment, hopefully on a more, hopefully on a positive note. Happy Passover and Easter, which is coming up right around the corner. You know, Mr. Supervisor and team, I think you guys did a great job getting us on this Zoom conference. And you could do a Passover / Easter on Zoom as well. And we've done a few dinners, a few anniversaries, birthdays, etc. It's not ideal, but it keeps you going. And I thank the supervisor for reminding us that that possibility exists. And it's what helps keeps us going. So thank you.
Okay. All right. I'll make a motion to adjourn.
Second.
Second.
All in favor?
Aye.
Aye.
So moved. And good night, Somers.
Thank you.
Thank you.
Good night.
Thanks, guys. Be safe.
Good night.
All right.
Good night.
Good night.
Good night.